Welcome back to Healthy Living. Our next guest is Joe St. Philip. Joe is the Director of Emergency Services, and he for our offsite Mandeville Emergency Department. So thank you, Joe, for coming and being with us today. Tell us a little bit about yourself first. Let's talk about you for just a second.
Well, Amy, thank you for having me. Well, about myself, I'm from Mandeville. I'm graduated from Mandeville High, so I'm a skipper. I've been in healthcare for about 20 years. The last 5 years, I've had the privilege of working for St. Tammany Hospital. And for about the past 2 years, I've been over the Mandeville Offsite Emergency Department.
Okay, so your role, you basically are in charge of that whole facility, correct?
Yes, ma'am.
Okay, so I don't know how many people know, I know about it. How long has the Mandeville Emergency Department been there?
So we're going on almost 5 years now. It's been in Mandeville. It's a great location. It's located right across from Mandeville Post Office. Off of Highway 190 between CVS and BSN.
Okay, so it's right there, right in the heart, lots of neighborhoods around it, lots of other things around it. And like you said, we've been there for 5 years.
Yes,
so it is, it's kind of like tucked away and, you know, it's right there. There's not a lot of flashing lights and sirens and things, but it is a full service emergency department, open 24/7.
So full service, just like if you went to St. Tammany Parish Hospital and the ER there, it's basically they just cut that out and set it in Mandeville as a standalone facility. We still have patients that come in today and be like, oh, I didn't know y'all were here. So still trying to get the word out to the community. It's a great, it's a great service that we're able to offer to the community and for the citizens of Mandeville. So we have, it's a fully functional emergency room. We run labs, any type of radiology type diagnostic testing. We can work, anybody up to rule out, the acute, illness that's going on or emergency.
So, I mean, you can go in there from anything for a sprained ankle to an appendicitis attack, basically.
Yes, ma'am.
And get cared for. So, it's also conveniently located around some of our, like Pelican Park and things like that. It's just a few minutes away. So, tell people, we do get confused sometimes with an urgent care. So, there's a difference between an ED and an urgent care, and this is not an urgent care. So what's the difference? What should people know?
Yeah, so we're emergency rooms, so we are, one of the biggest differences, we are open 24/7, 7 days a week, holidays, weekends, we're there. Urgent care is going to see a lot of, say your minor type stuff, scrapes, bruises. I mean, even some different, fractures or broken bones. For emergency room, you want to think of the severe things like severe chest pain. If you're having, heart attack type symptoms, stroke symptoms, any type of, severe bleeding or respiratory issues, especially, around certain times of the year with the weather and the asthma and everything like those that will start up. Anything with allergic reaction, excuse me, abdominal pain, dehydration, talking about the summertime safety right now. Those are definitely a lot of the top things that you would come to the emergency room for. And for, like I said, urgent care, just your minor, bumps and bruises, burns or scratches and so on and so forth.
Yeah, so we want people to know this is an actual emergency room. It's just like if you would go to St. Tammany Health System's flagship St. Tammany Hospital emergency room, you're going to get the same care. And if for some reason, you do need to go to the hospital, we will make sure you get there. Just kind of tell people, kind of give them that safety net assurance.
Yeah, so for peace of mind, we are a standalone facility, so we don't have beds. But what we'll do is we'll come in, we'll work you up, we'll rule out all of the emergent type stuff. If something does require to be admitted to the hospital, we will transfer you to the main hospital.
And you'll be stabilized.
You'll be
right?
stabilized, and then we'll transfer you, have you admitted to a room there, or sometimes, ER to ER, depending on what's going on. But, just peace of mind that any life-threatening condition or anything like that, we will have you transferred immediately to get you to the main hospital.
So we were talking a little bit ago that, obviously we're in the middle of a heat wave. It's going to get worse. So what are some types of things you're seeing right now, and what can people do to prevent coming to see you for heat-related illnesses?
Well, definitely with the summertime, we're averaging 90s, the heat index well above 100. Just hydration, just stay hydrated, and not alcohol type hydration, but just water. Your Powerade, your Gatorade, things with electrolytes in it, and just be mindful of being outside. You're sweating. You don't realize that after 30 or 45 minutes how much you've already lost. So just really just be safe. Wear your sunscreen, wear your hats, your long clothing to help protect your skin. and just be mindful of your surroundings. If you're out, with 4th of July, right around the corner, right? It's gonna be
Right.
a lot of boating, a lot of drinking going on. So just be smart about it, and wear your life jackets in swimming pools. You're gonna be around kids. Just keep an eye on everything, and just overall safety. But hydration is going to be one of the biggest things to get through the summer.
And that's for adults and children. And you
Adults,
did
all
mention
ages.
children. And we want to make it clear that the emergency room in Mandeville sees all ages. So you
see all ages.
You probably see lots of children.
We
I
see
would
from
imagine.
newborns, pediatrics, all the way to geriatrics. So we cover the lifespan.
So we are a full service freestanding ED. So we want to make sure that people know that. And let's think of is there any other things you want people to know about the Mandeville ED, about its convenience, its location, the staff you have on hand?
Yeah, so we have a great team. It's an awesome team all around. As far as we do have some resources out there if you want like wait times. It's always a question about wait times. So
Right.
we have the website through St. Tammany, and also in the app, in our St. Tammany app, that'll kind of give an idea what the wait times look like, which those can change a little bit because people come in at different times, and you can have 2 or 3, and before you know it, 15 or 20 people. So
Right.
that'll kind of help give you a guide to it. And as far as trying to figure out the differences between primary care, urgent care, and emergent care, on our website you can find it, also in our pamphlets in our physician offices. They do have a handout. And then on the after visit summary, which is the AVS, when someone's discharged, it does have it on the back sheet, the differences of each one.
Okay, good. Well, thank you so much, Joe, for being with us. Again, we are located, let's say the address.
2929 Highway 190.
US I 190, right across from the Mandeville Post Office, right in the heart of that Mandeville area, just a couple of minutes from Pelican Park and a lot of the neighborhoods around there. So we want people to know we've been there for 5 years, taking care of you and your families, and we're there if you need us this summer. So thank you for joining us.
Well, thank you for having me.
And thanks for this great information. So stay with us on this episode of Healthy Living. We are going to come back with Marla Rabelais. She is from the Parenting Center, and we're going to talk again about summer safety mostly for your children. So stay with us.